So.
As a psychiatrist, I've had the privilege of meeting with thousands of patients and hearing their stories. Hearing about their lives, families, hobbies, and what they hope their lives would look like. I also hear about their greatest fears, failures, and the worst moments of their lives. On a Thursday afternoon, I met with Jane, a mother of two, referred to me for treatment recommendations for her depression. Jane was also a teacher, but had been on disability leave for the past 2 years. In my office, Jane opened up her backpack and one by one took out the various antidepressant medications she had tried, all of which were not helpful and had challenging side effects. Unfortunately, for patients that have tried a variety of antidepressants and are still not getting better, the likelihood of yet another standard antidepressant working is less than 10%. This disturbing statistic has haunted me since the beginning of my medical training. In every patient interaction, I can't stop thinking, we have to do better. These outcomes are unacceptable. This constant discontent with currently available treatments is what has driven me to dedicating my career to conducting clinical trials to find better treatments that may dramatically improve patient outcomes within our lifetime. One intervention we're studying in the lab is psilocybin, the active ingredient in magic mushrooms. Psilocybin creates an incredibly novel altered state of consciousness, sometimes called a psychedelic trip, that dramatically changes the way you view yourself and the world around you. We're learning that psilocybin encourages the brain to rewire itself in ways that may dramatically change the way that you process, think in more resilient, adaptive, and flexible ways for your thoughts and your behaviors. So what does it actually look like when participants are in our clinical trials? Pictured here, you can see one of our psilocybin dosing rooms at Krembil, just a few floors above where we're standing right now, actually just next to the clinical research unit. As you can see, it looks nothing like a standard hospital room. In our trials, we combine psilocybin with talk therapy. We believe that psilocybin may act as a catalyst to achieve breakthroughs in psychotherapy that may have not otherwise been possible due to the hardwired defense mechanisms that are commonly seen in depressed patients that prevent them from benefiting from therapies. We're conducting numerous clinical trials and starting to learn that psilocybin's benefits are likely far beyond just depression alone. Psilocybin and psychedelics more broadly have shown promising results for anxiety, depression, eating disorders, chronic pain, PTSD, and even bipolar disorder. With these benefits seen across such diverse conditions, we're starting to reconceptualize psilocybin not only as an antidepressant, but potentially as an antidistressant, with benefits for reducing distress and improving quality of life across diverse conditions. But we don't want to only understand what are the benefits of psilocybin, we want to understand how it works and what it could teach us about the fundamental underpinnings of how the brain processes pleasure, joy, happiness, suffering, and pain. For example, we're conducting studies where we conduct MRI brain scans before and after patients receive psilocybin, so that we can learn how psilocybin changes the brain. We also have participants complete tasks while in the MRI brain scanner to see how their brain responds in real time to positive and negative emotional stimuli after receiving psilocybin. Beyond psilocybin, we're conducting numerous clinical trials with a variety of novel interventions. We're also working hard to better understand the biology of mental illness and conducting biomarker-based studies to better personalize care so that we can select the best treatment for you right at the beginning, rather than the current standard and error approach. I sincerely hope that these 3 lines of research will help Jane to get her life back. And I believe the ripple effects cannot be underestimated, as Jane's students, husband, son, daughter, and other family members and friends would all benefit from Jane's recovery. I'm grateful that we can offer Jane a message of hope and the possibility of even participating in one of our psilocybin clinical trials to receive a treatment that is completely different from the standard of care. More broadly, we are reimagining what the standard of care for mental illness treatment looks like. At Krembil, insisting on better outcomes for mental illness is a top priority. And we're partnering with other experts in the field, such as the Center for Addiction and Mental Health, CAMH, so that together we can find better treatments for our patients. Thank you.
Thanks very much, Josh. So it sounds like there is incredible potential for psilocybin. I sort of have a two-parter question. I'm wondering how helpful it can be for patients who are severely depressed and hard to treat. And then sort of the second part to that is, assuming that though it's not the cure-all for everything, what other kinds of interventions would you be studying?
Great question. So for the first part, definitely, that's actually the main group that we're studying it in severely depressed people that are particularly difficult to treat, sometimes that have tried dozens of medications. So it's certainly being studied in people with first episode depression, but also people that are severely treatment resistant and have tried everything under the sun. And it does seem to have some pretty promising effects in both categories. And you're right, no intervention works for everything, including psilocybin. So we are doing that biomarker-based research to try to better understand who's going to respond to which specific novel intervention, and we're studying a number of other novel interventions. One of our other largest programs is looking at ketamine, which is actually an anesthetic, and we use it at sub-anesthetic doses, so lower doses, and we're finding that it has some fairly promising benefits for things like depression, anxiety, and even personality disorders. So ketamine, psilocybin, and a number of other interventions we're studying because we're recognizing that it's not going to be a one-size-fits-all for something as heterogeneous and diverse as depression. Great question.
All right. Okay. Thanks so much, Josh Rosenblat. Thank you.